So patients with an extension preference, meaning they feel better with their backs bending backwards slightly as opposed to coming forward. Coming forward increases your pain, where going backwards decreases it. Now, I don't mean trying to do a back bend, we're just offloading a little bit. The majority of issues that feel better with this are disc-related issues, meaning a bulging disc or a herniated disc. Not all of them, but most of them do well with that extension preference. And so what I have people start with is if you're standing upright, hands on your hips, you're just going to lean backwards slightly. I'm not trying to do a back bend. I'm just unloading the front part of my spine. And if you can imagine, my vertebrae are creating some space here so that my disc has more room to work with. The progression of extension biased exercises would be to then get onto your stomach. And I have patients start lying flat. You can use a pillow, you can rest your head on your hands, whatever feels comfortable, but your job here is to take some deep breaths and just try and relax into the position. If you can get here and there's no sharp pains, then see if you can prop up onto your elbows, kind of like you're reading a book or watching TV. If this creates a spasm or if you get any sharp discomfort, then come down to that flat position again. If it feels okay, you can hang here for, up to 5 minutes. If this feels like it feels pretty good, but you want a little more, then you can progress into a prone press up. So now, I'm going to press up with my hands. My hips are staying on the table. I'm just extending my back and then coming back down. You can hold this for 10 seconds or so, or just come up and down, but make sure that you go in and out of it slowly and controlled. As you come up, make sure that shoulders don't end up in your ears, so pull those guys down, and if it feels like it's too much, then just come down a little bit.